For many of us, light and electricity are an afterthought. We flip a switch and our homes are illuminated. We open our computers and the world is at our fingertips. We use our cell phones for work and to call friends and family. But for 1 billion people, life is very different. 1 out of every 7 humans is living without access to electricity. If you add the word reliable, that number doubles. My name is Megan Burney, and I'm president and CEO of the nonprofit Unite to Light. I want to share some stories with you about how access to light and energy are enabling health innovations across the world. Then, I'll walk through some tips on how to pick a personal solar device like a solar light or a solar charger and battery bank. Let's start with a recap of why access to clean, safe, and affordable light and energy are important. In the absence of a good alternative, people resort to burning candles, wood, dung, and kerosene to see at night. These are dangerous, expensive, polluting, and, especially pertinent to healthcare providers, these are poor sources of light. This leads to a host of issues related to health, education, and economic prosperity, including respiratory diseases, fires and burns, reduced productivity, and impacted care. In short, lack of light and electricity keeps people stuck in a cycle of poverty. Our solution is solar light and power. We realize we are not going to solve all the world's problems with solar lights, but they do open doors and increase opportunity. That belief underlies our vision, that clean and affordable light and energy are crucial to global health, education, and prosperity. That is why we have made it our mission to provide low-cost solar light and power to people living without electricity. We started by designing a light that would give a student a chance to study at night. We made it lightweight, compact, durable, inexpensive, and bright. Several years later, we added a solar charger and battery bank so that healthcare providers and entrepreneurs could power cell phones and small electronics using the sun. Over the last 10 years, we've been amazed at how people use our lights and chargers to improve their lives. Today, I'm going to focus on our health-specific programs, including supporting midwives, providing disaster response, and aiding our neighbors experiencing homelessness. Let's start with our midwives program. Did you know that a woman dies giving birth every 2 minutes? 7 women will die in the time it takes to watch this presentation. This number is not universal. Where you are in the world matters a lot. A woman in Haiti is 130 times more likely to die in childbirth than a woman in Germany. The good news is that most of these deaths can be prevented by having a trained midwife or community healthcare worker assisting the mothers before, during, and after birth. We are honored to work with the United Nations Population Fund, the UNFPA, and others like the Maternity Foundation and Hope Health to provide our solar lights and solar charger to their midwives and community healthcare workers. In 2017, we began partnering with the UNFPA in Bangladesh to provide their midwives with solar lights. After their training is completed, these midwives often return to their communities where they are the only trained medical providers. Access to portable, personal solar devices is crucial for these midwives because even where there are clinics, like this one in Bangladesh, they are often without electricity or have infrequent and unreliable electricity. One midwife told us she was grateful to have electricity just a few hours a day. Oftentimes, midwives go to birthing mothers, traveling long distances on foot through rural communities, sometimes in the middle of the night. We've heard stories from midwives around the world about helping mothers give birth in mud huts, by candlelight, or having to relocate mothers in trouble outside so they can use car headlights to identify the problems. This is unacceptable when we have the technology to harness the sun and provide light and communication to these midwives so they can reduce maternal mortality. The year we started working with the UNFPA was also the year that the Rohingya refugee crisis really hit Bangladesh. Over 1 million refugees sought shelter, many of them pregnant women with children. The UNFPA worked to get these mothers and children resources to survive, and that included our solar lights. They handed out thousands of our lights so that mothers could better care for themselves and their children. As you might imagine, some of our programs overlap. The Rohingya refugee crisis is clearly a disaster, if a man-made one. And disasters trigger some of the greatest need for our products. Disasters don't know geographic or economic boundaries. An earthquake is equally unsettling if you live in a hut or a high-rise. Our primary partner in disaster response is Direct Relief. They are a nonprofit that provides medical supplies around the world every day to partners in low-resource areas for no cost at all. They also respond to disasters, often through their existing, established network of healthcare providers. In the immediate turmoil of a disaster, they are providing assistance to first responders, doctors, nurses, clinics, and victims. In 2017, they supplied 59 community clinics in Puerto Rico with medicine and supplies, including thousands of our solar lights, so that victims of Hurricane Maria had light and power when their infrastructure was down for months. Direct Relief is also there for the long term. They continue to provide support for students in Nepal years after the earthquake there. Here, they partnered with Mountain Heart Nepal to provide books and our solar lights to students who live without electricity. This allows them to read and study at night and gives them the greater opportunity to break the cycle of poverty. We know that by giving a student a solar light, they are 30% more likely to stay in school, pass on to the next grade, and eventually graduate. Sometimes we forget about those who need help a bit closer to home. There are over 500,000 people experiencing homelessness in the U.S. at any given time, but according to the National Health Care for the Homeless Council, each year 1.5 million people access services intended for the homeless. These are our neighbors and a forgotten population, not just in terms of access to light and power, but other basic services and community. Homeless people tend to have higher rates of chronic diseases like diabetes, hypertension, mental illness, substance abuse disorders, and even some infectious diseases. And this takes a toll. While average life expectancy in the U.S. is about 78 years of age, the average for people living on the streets is just 50. People experiencing homelessness are also more likely to need to access emergency medical services. The Los Angeles homeless population made up less than 1% of the city's residents in 2018, but they accounted for more than 10% of all 911 emergency medical service calls. There are people trying to change that. They're engaged in what is called street medicine. Street medicine is a movement where clinicians and volunteers meet patients where they are, often in riverbanks, on sidewalks, or near train tracks. They build trust, provide care, and help them establish medical routines. We've partnered with Doctors Without Walls, Santa Barbara Street Medicine, to get cell phone chargers and lights into the hands of these providers so that they can provide better care and longer care. We're also providing cell phone chargers to our neighbors experiencing homelessness, focusing on those working to establish medical routines with Doctors Without Walls. A cell phone is more than a convenience for someone living on the streets. It is often their only source of light and only tool of communication. Cell phones are also used to connect to services like healthcare, housing, and employment. A light can be an excellent deterrent to a thief or an attacker and a lifeline in times of trouble. The impact of these efforts is global. We have distributed over 125,000 solar lights and chargers to people in 78 countries. We know that we are reducing exposure to toxic smoke and fumes and saving valuable money that can be spent on food, school fees, and medical supplies instead of fuel. What is tougher to track is the impact on the people themselves. We know that mothers are getting better care and are more likely to survive when a trained midwife is present at birth. We know that giving a midwife the tools she needs further increases her efficacy and even her standing in the community. We know that immediate aid after disaster increases the likelihood of survival and creates hope, and long-term aid creates opportunity. We also know that our neighbors experiencing homelessness are working to establish medical routines that increase their quality of life and decreases the chance they will end up in an emergency room. Now we'll go through some tips on how to pick a personal solar product, focusing on solar lights and solar USB chargers with battery banks. Unite to Light does manufacture lights and chargers, but our advice is meant to be general to any product. To start, identify your use case. Who will be using the product and what type of light do they need? A point source or a task light is going to be better for reading, medical examinations, times you need to see specific objects or read words on a page. Ambient light is better to light a room or for seeing people during a conversation. This photo is of our Luke light, a point source or task light. Then, ask if you need light or light and power. Note that most solar chargers include a light source. So for our students and nursing mothers, a simple light was adequate. But for midwives using a tablet for training or an unsheltered person who needs to call their doctor, power is very important. Second, ensure that your device can be charged entirely from the sun. For solar lights, this tends to be a given, but for solar chargers and battery banks, it's not always the case. Sometimes the panels are just meant to supplement the power that you're getting from a wall charge. If you're planning to use the device for multiple days or are charging multiple devices, you'll want adequate solar panels to recharge that battery. To calculate how to right-size your solar charger and your battery bank, I'm going to point you to the blog on this very topic, which is linked here. The calculations can get quite complex. Last, you'll want to account for safety and longevity. A low-quality device may in fact harm the electronics you're trying to charge. Look for terms like overcharge and overcurrent protections. You'll also want to ensure that the units you're ordering are in compliance with basic health and safety guidelines. CE and FCC certification should be the bare minimum for any electronics. For solar lights, there's also the Lighting Global Standard, which is a World Bank initiative that verifies the performance of solar lighting products. We are honored to partner with amazing organizations and people they support across the world and to provide them with best-in-class solar products. If you want to get involved, consider light and power in your work. Pick a technology that will best meet your needs, and don't be afraid to reach out if you have questions. Partner with us to provide our solar products to health innovators. Whether it's our basic solar task light or our solar charger, we are confident that health outcomes will improve with access to light and power. Help share our story. Many people don't realize not only the number of people living without electricity, but the impact that lack of electricity has on health outcomes. For more information, please check us out online at unitetolight.org or email me directly. Thanks for your time and attention.